Hello, my name is Cassie Traum, and I did the presentation on traumatic brain injury. Traumatic brain injury, also known as a TBI, is an acquired disability, therefore covered under either the IDEA or Section 504. The IDEA defines TBI as an acquired injury to the brain caused by an external physical force, resulting in total or partial functional disability or psychosocial impairment, or both, that adversely affects a child's educational performance. There are three aspects of the definition. One being acquired injury, and this is occurring after a child is born. It is inappropriate to classify a student as having a TBI if their brain injury was congenital. TBI must be caused by an external physical force. If a student had encephalitis, let's say, this would not be classified as a TBI. Or an open or closed head injury. Open head injury means that it penetrates the bones of the skull, allowing bacteria to have contact with the brain. And closed does not involve penetration or fracture of the bones of the skull. This results from an external blow or from the brain being whipped back and forth. Here are some statistics. In the 2015-2016 school year, approximately 4%, which is 32,785 of all students ages 3 through 21 receiving special education services were classified as having a traumatic brain injury. Approximately 1.7 million people annually sustain a TBI. Approximately 1/3 of all injury-related deaths in the United States are related to a TBI. Children from birth to age for adolescents 15 to 19 and older adults over 65 are most likely to sustain a TBI. Characteristics of TBI. Students with TBI differ from each other in terms of onset, complexity, and recovery. They often share similar characteristics with students who have learning disabilities, communication disorders, emotional or behavioral disorders, intellectual disabilities, and other health impairments. Some more characteristics. Physical characteristics can include coordination problems, physical weakness, fatigue are all common effects of TBI. Prior athlete students often find this change to be very frustrating. Fortunately, coordination and physical strength usually improve after the injury as students' brains heal and they undergo rehabilitation, especially occupational therapy, to reacquire their fine motor skills. Some cognitive characteristics. Students who had sustained a severe brain injury had increased rates of intellectual impairment, particularly related to nonverbal skills. The cognitive impairment of brain injury often results in problems associated with memory, planning, problem solving, and abstract reasoning. The student's age at the time of the injury is the second factor affecting cognitive functioning. Those injured under the age of 4 demonstrate greater rates of cognitive impairment than those over the age of 4. And some emotional, behavioral, and social characteristics. Emotional, behavioral, and social changes can be especially problematic for children and youth with a TBI. Students who experience severe TBI at an earlier age have significantly higher levels of internalizing and externalizing behavioral problems. Depending on the severity and age of the injury, students with TBI have an increased risk for challenges related to inhibiting, stopping, or redirecting their ongoing actions. So we have some causes of TBI. So there are 4 major causes of acquired TBI. One being false, accounting for 35% are the number one cause of TBIs. They are frequent among young children from birth to age 4 and adults age 75 and older. Automobile accidents are another cause. They account for 17% and are the leading cause of death from TBI and occur most frequently among adults 20 through 24 years of age. Most of this is caused by driving under the influence. 3, being struck by or against something, accounting for 17%, typically occurs in sports or recreation when a person collides with a moving or stationary object, such as sledding, skiing, snowboarding. And assaults, accounting for 10% of this, frequently involve firearms. And 4, unknown other causes account for 21%. In infants, shaken baby syndrome refers to TBI resulting from the caregiver shaking a child violently. Identifying the disability. The evaluation of students with TBI needs to be comprehensive and ongoing because the child is always changing. They have the non-discriminatory evaluation process. We have the observation, which will come from parents, physicians, and teachers. Parents can sorry about that. Parents can be able to relay to the physicians and teachers of what they're seeing at home and what may have happened. 2 is screening. They will have scanning instruments, neurological exams, and a coma scale. 3 is the pre-referral. Typically, this is not used with TBI students because of the sudden onset of the disability. 4, we have the referral. Students with moderate to severe TBI should be referred to special education for evaluation. 5, the non-discriminatory evaluation procedures and standards. This includes adaptive behavior skills. The students may have difficulty in social, self-care, household, and community skills as a result of the injury. They have cognitive processing tests. The student may have difficulty in areas of attention, memory, concentration, motivation, and perceptual integration. Social, emotional, and behavioral changes. The student may demonstrate difficulty relating to others and behaving in socially appropriate ways. Anecdotal records. The student's cognitive, communication, motor, and behavioral skills appear to have changed from what was indicated in records before the accident. Curriculum-based assessments. The student may have difficulty in areas of curriculum that were not problematic before the injury. And direct observation, the student appears frustrated, has a limited attention span, tires easily, or lacks motivation to perform academic tests. And number 6 in identifying the disability is determination. The evaluation team will then determine if special education and other related services are needed or not. Instructional supports. Students with TBI often have impaired executive functions. Helpful tool to assess behaviors related to the executive functions related in educational settings and the Behavioral Rating Inventory of Executive Function, also known as BRIEF. BRIEF has scales to cover behavioral regulations and metacognition scales. BRIEF requires approximately 10 to 15 minutes and is good for students ages 5 through 18. Paraprofessionals can be placed with a student as a supplementary aid and services. Paras can provide clear description of the educational practices, its purpose, and its implementation. They can model the practice, and they can provide performance feedback. 22% of students in regular class are in regular classes 40 to 79% of the time. 50% of students with TBI are in regular classes 80 to 100% of time. 20% of students are in regular classes 0 to 40% of the time. 8% are in separate settings. Collaboration with families. We need to have a person-centered planning, which is practice that you and other teachers will often use as you partner with students and their families to identify goals, values, and visions for the future, and to use this information to design IEPs and plan for transitions. This puts the students with a disability and the family at the center of the process of the building system of supports in education and community contexts. Key features in education context include aligning special education services with personal values and dreams, focusing on the inclusion of people who are important to the person with a disability, building natural supports, building relationships and networks that foster participation in inclusive environments, and fostering leadership by the student with a disability. MAPS, also known as Making Action Plan, process can be divided into 3 phases: preparation, meeting, and follow-ups. The preparation phase involves identifying and getting participants ready for the activities that will occur in the series of meetings. The meeting phase typically involves 2 or 3 meetings and culminates with the creation of a plan. The follow-up phase includes additional meetings or activities needed to promote the sustainability and implementation to the plan. Following goals that drive the meeting phase. You need to hear the person's story. So what is the person's history? You need to honor their dream. What is the dream for the person? Recognize their nightmare. What is your nightmare? Name strengths. Who is the person? Name needs. What are the person's needs? Agree on actions. What would the person's ideal day at school and in the community look like? And you need to develop a plan. What must be done to make that happen? Some additional resources for students with TBI can be assistive technology. Assistive technology can be used to promote access, inclusion, and progress for students with disabilities. These can include environmental access, mobility, positioning, communication, and learning. Students with TBI can benefit from technology supports related to memory, language, and cognitive supports. Audio recorders can be used to capture lectures. A calendar app can be used on a smartphone to help remember appointments and medications, or screen recording software to support literacy and text comprehension. Students' needs, interests, and abilities, environment in which the technology could potentially be used, tasks for which the technology could be used, and technology that might be able to meet the student's needs. Transition strategies is defined as a coordinated set of activities that promote movement from school to such post-school activities as post-secondary education, vocational training, employment, adult services, independent living, and community participation. They must be based on the individual student's needs, taking into account his or her preferences and interests. Transition services must be instruction, community experience, and development of employment and other post-school adult living objectives. Here are some transition strategies. So transition to promote independent living. We can teach self-care, independent living skills, teach self-advocacy skills, and have community-based instruction to teach purchasing safety, food preparation, and grocery shopping skills, and video modeling and video self-modeling. And another transition strategy is a transition practice to promote employment. Promoting employment includes students' involvement in transition planning, promote employment skills and specific job skills, and provide career awareness activities, work-based social skill training, travel skill training, and young autonomy skills. So this is one of the biggest reasons I chose TBI. It's near and dear to my heart. My husband is a combat veteran who encountered an IED in war. His Humvee was hit, and due to that and the force and the trauma, he did get a TBI during that time. It has been a rough road for him, but we have dealt with it every day, and we will continue to deal with it every day. Here are my references. I did just use the book for all my information received. Thank you so much for listening to my presentation about traumatic brain injury, and I hope you guys have a great day.